Dengue is a serious health concern around the world. It affects millions of people each year, causing widespread illness and even death in severe cases. It's a viral infection spread through mosquito bites. The mosquitoes that carry dengue are most active during the day, especially during early morning and late afternoon. You might hear it called break-bone fever because of the severe muscle and joint pain it can cause. Symptoms can also include high fever, severe headache, pain behind the eyes, and rash. Millions of people get dengue each year. The burden on healthcare systems in affected regions is immense, often leading to overcrowded hospitals and clinics. It's most common in tropical and subtropical regions. Countries in Southeast Asia, the Pacific Islands, the Caribbean, and Latin America are particularly hard hit. Dengue is a leading cause of illness and death in many countries. The World Health Organization estimates that about half of the world's population is now at risk. Climate change and global travel are making it even more common. Warmer temperatures and increased rainfall create ideal breeding conditions for mosquitoes, while international travel can spread the virus to new areas. This essay will give you important information about dengue. You'll learn about its symptoms, how it spreads, and the steps you can take to prevent it. You'll learn how to protect yourself and your loved ones. Simple measures like using mosquito repellent, wearing long sleeves, and sleeping under mosquito nets can make a big difference. Community efforts to reduce mosquito breeding sites, such as removing standing water, are also crucial in the fight against dengue. Together, we can make a difference in controlling this global threat. Dengue usually starts with flu-like symptoms, which can be quite misleading at first. You might think it's just a common cold or the flu. You might have a high fever, headache, pain behind your eyes, and muscle aches. These symptoms can be severe and debilitating, making it difficult to carry out daily activities. Some people also develop a rash, which can appear a few days after the fever starts. This rash can be itchy and uncomfortable, adding to the overall misery of the illness. Most people recover from dengue within a week or two with proper rest and hydration. It's important to follow medical advice and take any prescribed medications to manage the symptoms. However, dengue can sometimes progress to a more serious form called severe dengue. This is more likely to happen if the initial symptoms are not properly managed or if the person has underlying health conditions. Severe dengue is a life-threatening medical emergency that requires immediate attention. Quick and effective medical intervention can be the difference between life and death. Severe dengue causes bleeding, organ damage, and dangerously low blood pressure. These complications can lead to shock, which is a critical condition that needs urgent care. If you've had dengue before, you're at increased risk of developing a severe case. It's crucial to inform your healthcare provider about any previous dengue infections so they can monitor you closely and take necessary precautions. Dengue is spread through the bite of infected Aedes mosquitoes. These mosquitoes are often found in urban and semi-urban areas. They breed in standing water, like in old tires, flower pots, and uncovered water containers. The Aedes mosquito transmits the dengue virus when it bites an infected person. The virus then multiplies inside the mosquito and can be transmitted to other people through subsequent bites. It's important to remember that dengue cannot be spread directly from person to person. Dengue is a major public health challenge, especially in tropical and subtropical regions. The World Health Organization, WHO, estimates that nearly half of the world's population is at risk of dengue. Each year, millions of cases are reported worldwide. Factors like urbanization, population growth, and climate change contribute to the spread of dengue. As temperatures rise, mosquitoes can breed in more areas and for longer periods. This increases the risk of dengue transmission. Section 5. Shielding yourself. Effective prevention strategies. Preventing dengue starts with mosquito control. The most effective way to prevent dengue is to avoid mosquito bites altogether. Use mosquito repellent containing DEET or picaridin. Wear long sleeves and pants when outdoors, especially during peak mosquito hours. Eliminate mosquito breeding sites around your home. Remove standing water from containers. Clean gutters regularly. And cover water storage containers. When traveling to areas with dengue, take extra precautions to prevent mosquito bites. Section 6. Vaccines and treatments. Hope on the horizon. There are now vaccines available to help prevent dengue. The most common dengue vaccine is called Dengvaxia. It is typically given to people who have had dengue before and live in areas where the disease is common. There is no specific treatment for dengue. However, early detection and access to proper medical care can significantly reduce the risk of complications and death. If you experience dengue symptoms, seek medical attention immediately. Section 7. WHO, leading the charge against dengue. The World Health Organization, or WHO, plays a crucial role in combating dengue globally. This mosquito-borne viral infection affects millions of people each year, particularly in tropical and subtropical regions. The WHO's comprehensive approach is vital in addressing the multifaceted challenges posed by dengue. The WHO provides technical guidance to countries on dengue surveillance, prevention, and control. This includes training local health workers, developing standardized protocols, and ensuring that accurate data is collected and analyzed. By doing so, they help countries to detect outbreaks early and respond effectively. They also support research and development efforts for new dengue vaccines and treatments. This involves funding scientific studies, facilitating clinical trials, and collaborating with pharmaceutical companies. The goal is to create safe and effective vaccines that can be distributed worldwide, as well as innovative treatments to reduce the severity of the disease. The WHO works closely with national governments, health organizations, and research institutions to strengthen global dengue response. This collaboration ensures that resources are used efficiently and that best practices are shared across borders. By fostering international cooperation, the WHO helps to build a united front against dengue. Their efforts focus on reducing dengue transmission, improving patient care, and promoting community engagement in dengue prevention. Community education campaigns are crucial in raising awareness about how to prevent mosquito bites and eliminate breeding sites. Healthcare workers are trained to provide the best possible care to those affected, ensuring that patients receive timely and effective treatment. Through these comprehensive strategies, the WHO aims to significantly reduce the global burden of dengue. Section 8. Your health, your responsibility. Taking action against dengue. Dengue is a serious health concern, but we can all take steps to protect ourselves and our communities. By understanding how dengue is transmitted and taking appropriate preventive measures, we can significantly reduce the risk of infection. Stay informed about dengue outbreaks in your area. Follow the guidance of your local health authorities. By working together, we can make a difference in the fight against dengue.